Magic moment.
Yeah, we're good to go.
Okay. We will convene the meeting of the Health Subcommittee for the House. I think everybody's here. It looks like we got a quorum. Go ahead and take the roll, Ms. Clerk.
Representative Boyd, Representative Byrd, Representative Freeman, Representative Hall,
Here.
Representative Jernigan, Representative Kumar, Representative Marsh, Representative Ramsey,
Here.
Representative Sherrill,
Here.
Representative Smith, Representative Terry. Chairman, you have a quorum.
Thank you. Do we have any personal orders this afternoon? If none, we will go right to the exciting calendar that we have. And item 1 is House Bill 2348. Chairman Howell, you're recognized. We have proper motion second on the bill.
Thank you, Mr. Chairman. Mr. Chairman, this bill seeks to clarify existing law regarding mental health transports. As you know, this problem of transporting mental health patients has been an issue for the sheriff's departments across Tennessee for a number of years, and this is mental health patients in jail who have committed crimes. In my district, for example, the Bradley County Sheriff's Office has been forced to pay $180,000 on average per year to transport mental health patients. Our sheriff's deputies are not mental health workers. They're law enforcement officers. So that means they're paying $180,000 a year in overtime and lodging for 2 deputies to transport an inmate or a mental health patient from Cleveland to Memphis, which is typical, a 2-day trip, 2 days with 2 deputies who are not patrolling our streets. The late Representative and Chairman Mike Carter helped establish a state grant program, you probably remember this back in 2020, to allow sheriffs to use the grant funds from the state to establish an in-house transport program or to partner and contract with a secondary medical transport service. I'm not talking about an EMS service, I'm talking about a medical transport service. They may be an EMS service, but in this case, the contract is for medical transport. That's what my sheriff and other sheriffs across the state did. My sheriff contracted with a company, 16 years old, who did this contract at no cost to the taxpayer, saving the taxpayer in my county alone $180,000 a year, because the medical transports, when they're done in a medical ambulance, are billable expense to the insurance. And they were glad to do it. This worked well until late last year when the state EMS board sent a cease and desist letter to the sheriff and the transport company. The board claimed that the transport company had to have a physical building and license in every county where that transport picked up a patient. Now, in this case, the transport company was 12 miles away, Hamilton County, Bradley County, about 12 miles. And the board said, no, you can't do that. Again, we're not talking about EMS. We're talking about a medical transport company with employees who are qualified to transport medical patients. That cease and desist letter, and I want to emphasize this, the cease and desist letter was not supported by law. It was not supported even within the rules and regulations of the Tennessee EMS Board. Based upon current law, these additional licenses are not required, despite the EMS Board's opinion to the contrary. This bill makes it explicitly clear, it's a clarifying bill, makes it explicitly clear that if a medical transport company holds a valid license in 1 or more Tennessee counties, they are not required to hold a separate license or establish a base of operations in every county where they provide mental health transport for the Sheriff's Department. And with that, Mr. Chairman, I urge passage of this bill.
Do we have questions or comments on the bill? I think Chairman Hall, you're recognized.
Chairman Howell, I just want to thank you for bringing this legislation. This is strong legislation. It relieves the burden from the county sheriff department. I just want to say thank you.
Thank you.
And recognize Chairman Terry.
Thank you, Chairman. Again, I want to echo his comments, thanking you for bringing this legislation. And you mentioned someone that's dear to our heart, Representative Carter.
Yes.
And I think he'd be proud of the way you presented this. In fact, I was getting a little nostalgic listening to you present. So I think this is a strong bill, and I appreciate you bringing it. Thank you.
Thank you very much.
And Chair Lady Smith, you're recognized.
Thank you, Mr. Chairman. And on behalf of the Hamilton County delegation, thank you for remembering our chairman who's leaning over out of heaven, giving the thumbs up. But also, I think that there's a clear commitment from this body not to incarcerate patients.
Yes.
And that we want to treat them with dignity and make sure that we treat them and get the help that they need. A lot of times this argument gets lost in money. It makes it sound like we're trying to cut corners and get people out of the jails, but instead we just want to make sure that we're taking care of patients and incarcerating prisoners. So thank you, Chairman Howell.
Thank you.
And Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. And also my sheriff and everybody I think really likes this bill. I appreciate you doing it. I do want to ask one question. You said when they carry this prisoner to the hospital, the insurance pays. Whose insurance pays for that?
Chairman Howell.
That is the insurance carried by that particular sheriff's department, I believe,
Okay,
because they have to have they provide medical service to their inmates.
so it's not costing the
It's not
county or
costing
the
the tax-
sheriff's
it's m-
department?
I'm sorry.
Yes, sir.
The way my sheriff explained it to me, it does not cost the taxpayer any money.
Okay, good, thank you.
Further comments or questions? I would like to ask, I've spent 20 years on county commission dealing with this issue with the sheriffs, and of course they love this concept, and I appreciate you bringing the bill. But you had mentioned that this was strictly for incarcerated people, but I think this also applies to maybe emergency room, because the sheriffs used to have to take people from, say, a mental illness encounter in an emergency room. They used to have to transport them to a facility. This would include those folks too, wouldn't it? This bill.
Mr. Chairman, I think I understand what your question is. My sheriff, and I think this is statewide, estimated to me that approximately 70% of the people in prison, in jails across Tennessee, have some level of mental health issues. And there are arrests made sometimes, and those people are taken to the hospital first. Then if they are picked up and asked to be transported to the county jail, and that inmate then is required to go to a mental health hospital like the one in Memphis, that should be covered under this bill.
Yes, and it's adequately. We were looking at the language though, and I think our sheriffs had voiced the issue over the years, decades, that they'd had to take folks from emergency situations in the hospital facility and transport them. And
Yes.
I would assume by the language here that this includes those individuals as well.
I believe you're correct, Mr.
That's
Chairman.
great. That's
And
really
as long as they are
fabulous.
transported in a
Yeah.
medical vehicle, an ambulance,
That's
then they are
fantastic,
billable
yeah.
to the insurance company.
Okay, well, that's wonderful. No more comments or questions. We will be voting to send this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved. Thank you, sir.
Thank you, Chairman of the Committee.
We go on to item 2, House Bill 2005, and I promised Chairman Crawford that he's chairing another committee. I promised him when he showed up at the door that we would take him next. So if there are no objections to that, we'll just kind of roll him a couple of spaces and see what happens. Item 3, House Bill 2054 by Chairman Campbell. You're recognized. Have a proper motion and second on the bill. I think there's an amendment with it. let's go ahead and take care of the amendment if you want. Does the amendment make the bill?
It does. It is 13623.
I have a proper motion and second on the amendment. Would you like to describe the amendment that makes the bill?
Thank you, Mr. Chairman and members. Current state law says that only a funeral director or an individual acting as a funeral director may start the death certificate. And this legislation will ensure that hospitals, medical examiners, and funeral directors are all part of the death certificate process. And this will be very clear who is able to begin the process of a death certificate in the state of Tennessee. My understanding is that the Tennessee Funeral Directors Association has been working closely with the Tennessee Department of Health, the Tennessee Office of Vital Records, and they've also been in consultation with the Tennessee Hospital Association, Tennessee Medical Association, Office of the State Medical Examiner, and members of the Medical Examiner Advisory Council in an effort to clear up any concerns around this legislation.
Okay, I see a lot of heads shaking out there, so you must be right on target. And my understanding is that it actually has designated the attending or pronouncing physician as the designated individual with responsibility. Any questions or comments on the bill or the amendment as stated? If not, we'll be putting the amendment on the bill. All those in favor say aye. Any opposition? We're back on the bill as amended. Any comments or questions on the bill as amended? If none, we'll be voting to send this to full committee. All those in favor say aye. Any opposition? So approved.
Thank you, Mr. Chairman and members. I have to present a bill in Crawford's subcommittee. I'm going to see if he can come on in.
Oh, okay. We'd go on to item 4, House Bill 2561 by Chairman Terry. You're recognized. Proper motion second on the bill. You're recognized.
Thank you, Chairman and Committee. House Bill 2561 would enter Tennessee into 2 interstate compacts. Section 1 of the bill is for occupational therapists, and Part 2 is for audiologists and speech-language pathologists. The compacts would allow reciprocity between these professions and other compact states. The scope of practice and standards would adhere to Tennessee standards, so we would not be lowering standards or changing their scope of practice. There is an amendment on this.
Go ahead.
Amendment
Yeah.
694.
And does that amendment make the bill?
No, this amendment clarifies Section 2 that there is no change in the scope of practice for the audiologist and speech-language pathologist, and also corrects a typographical error.
Okay, we have a proper motion and second on the amendment. All those in favor of placing the amendment on the bill say aye. Aye. Any opposition? So approved. We're back on the bill as amended. Do we have any questions or comments? I trust that this takes into account earwax removal. Okay. If none, we'll be voting to send this bill to full committee as amended. All those in favor say aye.
Aye.
Any opposition? So approved. We'll move on to item 5, House Bill 733. We have a proper motion and second on the bill. You are recognized, sir.
Thank you, Mr. Chairman. Actually, this is an HJR, House Joint Resolution 733. And committee, it is a pledge by members of the General Assembly to end the use of derogatory language in conversation or code directed toward or about our citizens and constituents with intellectual and or developmental disabilities. It's so easy to use words that have become part of the vernacular in our everyday lives that individuals with intellectual disabilities and their parents and their families very often hear others using the language that is disrespectful and honestly extremely hurtful, even when done unintentionally. As legislators and representatives of those who we serve, it is utmost importance that we neither intentionally or unintentionally use the type of language that will hurt our constituents. The federal government years ago removed the words mental retardation and mentally retarded from federal laws. However, these words and forms of these words continue to be used. These top words, even when not directly stated about people with intellectual disabilities, have devastating effects as they further negative stereotypes that hurt and isolate these families with individuals with disabilities and those who love them, and ultimately work against inclusion of our most at-risk citizens and their families. This resolution shows these valuable citizens that they are important to us and we respect them as individuals. With that, Mr. Chairman, I renew my motion.
Yes, and Colonel Whitson, I stand corrected, House Joint Resolution 733. Do we have any questions or comments on the bill? Chairman Jernigan, you're recognized.
Chairman Whitson, I just want to thank you for bringing this resolution. Words matter, and how we use them matter. And a statement like this from the General Assembly shows our intent. And I just want to thank you for bringing the resolution.
Thank you, sir.
Further comments or questions, and I too think it's high time that we address this issue. If not, we'll be voting to send this resolution to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Okay, thank you, Mr. Chairman. Thank you, committee.
Yes, sir. We go to item 6, House Bill 2131 by Speaker Marsh. We have a proper motion and second on the bill. And I wanted to sign on this bill, but I found out I already had. So you're recognized.
Thank you, Mr. Chairman. This legislation concerns pharmacy techs. Pharmacy technician means an individual who is specifically trained and designated to assist a pharmacist and may perform tasks delegated by the pharmacist. It permits a pharmacy tech to perform tasks delegated by the pharmacist, including drug, supplement, and device selection, storage, distribution, and administration, if the delegated tasks are consistent with the pharmacy tech's education, training, and experience. With that, I'll answer any questions.
Do we have questions or comments on the piece of legislation? If none, we will consider voting. No objections to passing this on to full committee. All those in favor say aye.
Aye.
Any opposition? So approved. So we are back. I noticed the imminent presence of our Chairman Crawford, and we're back on your bill. Item 2, House Bill 2005. You recognize we have a proper motion and second on the bill.
Thank you, Mr. Chairman. Thank you, committee. Today, we're going to talk about House Bill 2005. This is known as the massage therapy bill. I will try to make it as simple as possible. The reason I'm bringing the bill is because we have a problem, people moving into the state who are licensed massage therapists, and they cannot practice at this time, so there's income being lost and families not getting that income that they need. So what my bill does is fix that. If you are a licensed massage therapist in another state and you have all your credentials, you passed the boards, and you have paid your fees, then when you move to Tennessee, you could get a temporary license, which is 6 months, and that's enough time to study and get in one of the testing to get the Tennessee license. It's $268, I believe, for them to take the test, and $280, and we feel like that 6 months is adequate time for them to be able to learn what they need to do. They will be able to work during that time, so they will receive compensation under the temporary license, but they have to work directly under a licensed therapist from the state of Tennessee. At this time, I'll be glad to answer any questions.
Okay, do we have any questions or comments? Yes, Speaker Marsh.
Thank you, Mr. Chairman. Does a temporary license cost them anything?
$280.
And that will also pay for their license, the test for the new license.
Chairman Crawford.
That is
So it's
correct.
all
That's
in
my
one-
understanding, yes.
It's all in one fee then?
Yes.
Thank you.
Speaker.
There was
Chairman.
one question from a member of the committee as I was working the bill about who would regulate these individuals and following. It's the same people that regulate the licensed therapists in the state now. They would regulate and make sure that they are following all the guidelines and rules under the temporary license.
Further comments or questions? And I can guarantee you by the waiting times to get a massage therapist anymore, we don't have a surplus.
Yeah.
There's no way. And I had the question posed to the committee about how we could police people that came in and practiced without a license. You can't do that anyway unless they are willing to go to an insurance company and try to get liability insurance, and then they require it. So there are checks and balances to keeping people from practicing without a license.
Yes, sir.
Comments or questions? If not, we'll be voting to send this bill to the full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, Mr. Chairman. Thank you, committee. And for those members that I didn't get to see, I'll make sure I get with you and answer any questions before it goes to full. Thank you.
Thank you. And we are on item 7. That's House Bill 2416 by Chair Lady Smith, and that's been asked to be rolled for a week. The posture of the bill was our discussions going on to make put an amendment together, and she had requested the extra time to take care of that and see that it's done appropriately. So we will move on to item 8, House Bill 22. Pardon? Oh, you hit it. Item 8, House Bill 2259 by the other Representative Harris, and he has rolled that bill, requested if there's no objections, we'll roll that bill 1 week for the same process of amending. There are no other items on the calendar today. Do we have any comments or questions as we move forward? If none, we will be standing for a motion to adjourn. No motion to adjourn. Oh, okay.